All right. So before we get started, I'm going to read a disclaimer. The information shared during this class is intended for educational purposes only. My goal is to help you better understand health, nutrition, and how the body works so you can make more informed decisions about your well-being. The information presented today is not intended to diagnose, treat, cure, or prevent any disease, and it should not be considered a substitute for individualized medical advice, diagnosis, or treatment. All right. So I'm going to do a short presentation and then we're going to open it up to discussion. Anything goes, anything that you want to talk about. So today's topic, hidden causes of inflammation. And some of you may already know a lot about this, and some of you may hear things that you never heard before. So I'm opening up my notes now so I don't forget anything. So let's talk about what inflammation is to begin with, because a lot of people consider inflammation to be when there's, swelling, redness, tenderness, pain, but it's actually a lot more complicated than that. So inflammation is actually the body's natural defense and repair system. So it's not necessarily something bad. It actually serves a useful purpose. Without it, we could not heal from injuries or infections or repair damaged tissue. Inflammation occurs when the body detects a threat. So what qualifies as a threat? Well, first of all, injuries. Next, infections or pathogens. And lastly, toxins or irritants. And when the body detects a threat, it releases what's called inflammatory messengers. They act like an emergency alert system. And the messengers inform the body that it needs to increase blood flow to the area that's under attack, to send immune cells to investigate what's going on, to see if they need to get involved and maybe kill off some pathogens, to neutralize any threats, and to begin repair and healing. Some of some inflammatory chemicals include things that you may have heard of and some things that might be new words to you. For example, histamine, um, C-reactive protein, prostaglandins. And there's a lot of blood tests that can be done to check some of these markers. There's a blood test that's called C-reactive protein. Hi, Linda, there you are. C-reactive protein tells us whether or not there's an acute inflammatory situation going on. There's another blood test called ESR, or also known as sedimentation rate. So some of you may have seen some of these words on your blood work. Sedimentation rate is the rate in which red blood cells clump together and sink to the bottom of the test tube. And that's significant because the more inflammation there is in the body, the more they clump and the faster they sink. So that tells us that there's some kind of inflammation going on. It doesn't necessarily tell us what inflammation, but just that there's an inflammation situation. Another blood marker that can go up when you're inflamed is ferritin. So ferritin is actually iron. And your iron levels can go up in response to inflammation. Fibrinogen. Fibrinogen is something that helps with blood clotting. but that also can go up when you're inflamed. Another word that you might have heard or seen on blood work is homocysteine. And that's specifically an inflammatory marker that can predict heart disease or heart issues. That goes up in people that have the MTHFR mutation. If you're not familiar what that is, it's a mutation where you cannot absorb um, folic acid. And when you become folic acid deficient, your homocysteine levels go up, and then your risk of heart issues go up. How do you know if you have an MTHFR mutation? Which, by the way, that mutation, I have a whole video on this topic. That mutation is becoming more and more prevalent in the population because it gets passed down genetically. So, for example, if you have that mutation and then you have children, chances are your children will have it too. If both parents have it, then your children will have a full mutation. So you could have a half of a mutation or a full mutation. And with every generation, more and more people have this mutation. And the solution for that is to take a form of folic acid that your body doesn't need to process, that will just enter into your cells. So I have more and more patients going on that type of folic acid. Another chemical that gets secreted in an inflammatory process is cytokines. So I'm just naming these. These are not important to memorize or anything like that, but just in case you've heard of them and you want to understand what's actually happening. So all of these things, histamine, cytokines, prostaglandins, C-reactive proteins, they are the chemical messengers that help coordinate the body's response to injury or stress or toxins or pathogens. So histamines, most people are familiar with histamines. That can happen when you're sick, when you have a cold, when you're having an allergic response. It can cause redness, swelling, itching, mucus, allergy-like symptoms. Prostaglandins can increase your pain and sensitivity. Cytokines, do you guys remember during 2020, there was a lot of talk about the cytokine storm that was occurring due to the coronavirus? And they're actually just communication signals. Cytokines are just communication signals between immune cells. But when you have too many of them, it causes an increase in the inflammatory reaction of the body. And in the short term, inflammation is actually protective. But the problem occurs when the body keeps producing inflammatory signals day, what becomes chronic inflammation. And that happens when you're constantly being exposed to stressors. Then inflammation shifts from being helpful to harmful. So regarding testing inflammation in blood work, I want to make sure you understand that most people are in the middle of an inflammatory process before it even shows up on blood work. It's already quite advanced by the time you see it on blood work, which means it's an actually excellent idea to always be on some kind of anti-inflammatory support. And as we talk about the causes of inflammation, you'll see that it's almost impossible to completely avoid exposure to inflammatory stressors. Inflammation is more common today because 100 years ago, there were much fewer environmental stressors, right? Before there was all the technology and chemicals that we have now, people just simply had less exposure. 100 years ago, people would still experience infections and injuries and overuse injuries because of physical labor and occasional toxins because the sanitation system was not what we have today. And some third world countries still have that issue where the infrastructure is not sophisticated and they still have exposure to, let's say, feces, which contain bacteria. But 100 years ago, there were no plastics. There was no glyphosate. Everybody knows what glyphosate is, the Roundup, the weed killer. There was no synthetic fragrances. There was no artificial food additives. There was no wireless technology and the thousands of industrial chemicals that are commonplace in your environment today. So we're constantly processing chemicals and heavy metals. Once vaccines were invented, heavy metals were part of vaccines from just pretty much from the beginning. The function of heavy metals in vaccines is to stimulate the immune system, but it's not biologically natural to inject heavy metals into a bloodstream, and it causes damage. It creates an inflammatory response. We're constantly processing microplastics, pesticides. If you eat any processed food at all, you're eating chemicals, electromagnetic exposures, environmental pollutants. The immune system truly never gets a break. So it's important to understand that when you're exposed to toxins, which we've just established that all of us have some degree of exposure, no matter how hard you try not to, you're not living in a bubble. When you're exposed to toxins, your immune system is called to action. Okay, so your immune system is not just about pathogens. Your immune system is not just about fighting off bacteria and viruses and fungus and yeast and parasites. Your immune system is called to action when you're exposed to toxins. So when you have chronic toxic exposure, your immune system becomes depleted. And that not only creates inflammation, but also leaves you vulnerable to a pathogenic overgrowth because your immune system, when it's depleted, cannot fight off pathogens the same way. It makes it easier for microbes, the bad guys, to overgrow in your body. And there's another thing that a lot of pathogens feed off of toxins in your body. For example, parasites feed off heavy metals. So if you are full of toxins, you're more likely to develop an overgrowth of the bad guys. And let's also not forget sugar. I call sugar a hidden form of inflammation because most people, when I ask people, do you know that sugar is bad for you? Most people will say yes. But when I ask them why, they don't have a ready answer. Some people will say that it can cause diabetes if you eat too much of it. That's true. But most people will not answer with, it's inflammatory. Sugar is inflammatory. It actually causes damage to the inside of the lining of your arteries, of your blood vessels. When the inside of when the lining of your blood vessels become damaged, they become inflamed, right? Because the body is trying to heal the damage. What does the body do when the blood vessels are damaged? And Joe, you should know the answer to this because we just talked about it yesterday. The body sends cholesterol to the area to repair the damage. cholesterol is one of the inflammatory responses. So your liver produces more cholesterol in response to inflammation, and then the cholesterol is sent to damaged blood vessels to heal them. But what happens if you keep, let's say, eating too much sugar? You're going to keep damaging the inside of your blood vessels. You're going to keep having an inflammatory response. And eventually, the cholesterol will start building up there because it's sticky and it'll get stuck there. And then what happens? You have a clogged artery. And that's how that happens, right? So cholesterol is not the bad guy. Sugar's the bad guy. Sugar is highly inflammatory. Sugar also competes with nutrients to get into your cells, right? So if you think about, you eat a really healthy, nutrient dense meal loaded with minerals and other nutrients, and then you top it off with a sugar dessert, the nutrients and the sugar are going to get to the cell at the same time, and then they're going to get into a fight because there's only so much room in there. And guess who always wins?
Sugar,
Sugar.
the bad
The
guy.
sugar will beat the crap out of the other nutrients and enter the cell. And then you become nutritionally deficient. The more sugar you eat, the more nutritionally deficient you will be. When you're nutritionally deficient, your body will become inflamed. That's how that works. So let's talk about some other hidden sources of inflammation that most people don't think about. So we mentioned earlier food and farming chemicals, glyphosate, pesticides, herbicides, insecticides. Unless you're eating off of a farm that uses no chemicals, you are eating these chemicals. If you live near a farm, you are inhaling these chemicals. It also gets into the ground soil, then it gets, then you're drinking these chemicals. Also in processed food, artificial colors, artificial flavors, preservatives, artificial sweeteners. They're all extremely toxic. So your body will have an inflammatory response if it is exposed to these things. And then, of course, let's not leave out processed cooking oil. So I think most of us know that seed oils are not good to cook with, canola oil, um, but also just processed man-made oils. So margarine, vegetable oil, corn oil, your Mazola, your Crisco. Sarah, I don't know if they have those brands in the UK, but I'm sure you have equivalents. Yeah. And those oils are made with hexane, hexane gas. Hexane is gasoline. Um, and
Yeah.
that's in the oil. And it's extremely toxic. And not only that, but those types of fats enter into the inflammatory pathway. So there's all different kinds of fatty acids, and some of them are anti-inflammatory and some of them are inflammatory. Those man-made cooking oils are all inflammatory. Now, in unfiltered water, you have chlorine, which is toxic, pharmaceutical residues, agricultural runoff, as I mentioned, heavy metals, microplastics, and even there are other chemicals too, fluoride, bromide. So it is really important to have an excellent water filter or whenever available, drinking water from a clean mountain stream. Um, those of us that live in cities, obviously, we cannot do that. Anybody that watches me on David Mahoney, he lives in Spain. He actually has
Yeah.
a
That's
spring that
great.
he goes and fills up, large. bottles and gets his water from there. But the good news is there are excellent water filters available. So I highly recommend that you have one. Some other hidden sources of toxins that can cause inflammation, household products. So air fresheners, fragrances in general are extremely toxic, chemical fragrance. They're also highly addictive. They actually affect an area of your brain that causes an addictive response. So scented candles, fabric softeners, dryer sheets,
Toilet
and
paper.
yeah, I was going to get to that, I think, in the next, yeah, in the everyday items, but scented toilet paper for sure. Scented garbage bags, scented dog poop bags. They're all really toxic. And then, of course, conventional cleaning products. They're all chemicals. So if you need help finding cleaning products that are not toxic, pretty simple. I mean, baking soda, vinegar, washing soda, if you can get your hands on washing soda. In the States, a brand called Charlie soap is washing soda. And it does a fabulous job. It comes as a spray and it also comes as a powder. You can use it as a laundry detergent. You can add some essential oil if you like your clothes to have a little scent to them. Um, and then in place of dryer sheets, you can use wool dryer balls, totally non-toxic. Personal care products, conventional, commercial, personal care products, cosmetics, lotion, shampoos, antiperspirants and deodorants, fragrances, anything that you put on your body that is commercial, that's sold in a regular store is going to be full of chemicals. These things enter into your bloodstream through your skin. Your skin is very porous. And that includes sunblock. Um, I'm trying to think of any other, facial moisturizers, all of that stuff. So I'm not embarrassed to tell you that I use, we're all girls here. I use an organic um, intimate wash for my delicate tissues down there.
Yeah, what?
Completely, it's called, it's actually called organics, but the organic is with a Y. Organic intimate wash. It's a brand, organic with a Y. Um, and they have a lot of things for those of you that are still menstruating. They also have non-toxic menstrual stuff. They have a lot of good feminine products. But everything I use on my body, from my shampoo and my hair conditioner to my face soap to my facial moisturizers, my body lotion, my soap, my
Deodorant.
makeup, my my deodorant. I do not use aluminum antiperspirant. I have a couple of different brands of deodorant that I use. One of the ones that I actually sell, I'm pretty sure it's on my website, is called LaFaze, and it's a spray, and I absolutely love it. It's just so refreshing, and I spray it on my clothes. Um, and then another one that I buy sometimes is called Schmidt's, and Schmidt's is completely non-toxic and they have many different scents. So I use the rose one. I just like it. I like the way it smells. So just keeping in mind that deodorants do not stop sweating. They just help with odor. Sweating is a natural process. It's actually important for your body to sweat and your underarms. In fact, underarms, um, pores get clogged pretty easily. It's good to scrub them once in a while to do a little underarm detox with clay. You can use bentonite clay or French clay. And aluminum deodorants, I mean, antiperspirants actually damage the nerve cells in your armpits. And it's carcinogenic also. Aluminum is carcinogenic. Everyday items that you may not know are toxic. Plastic food containers. If you put hot food in plastic, the plastic leaches into the food. So if you're doing takeout and they send hot food in plastic containers or styrofoam, bleh, plastic water bottles, especially if they're exposed to heat, do not allow plastic. If you're going to drink out of a plastic water bottle, don't let it sit in the sun or in a hot car. Non-stick cookware, Teflon, is toxic chemicals. Receipt paper. I always tell them, you can throw that out for me. Thanks. I don't touch it. Stain resistant fabric, and whether that's on your couch or, something that you're wearing. Toilet paper usually is full of toxins. You can get toxin-free toilet paper,
Yeah.
but most commercial toilet paper is toxic, and your delicate tissues that you're using the toilet paper on absorb the toxins very easily. Tea bags. You can get tea that is in non-toxic tea bags, or you can get loose tea and steep it yourself with a stainless steel tea ball or strainer. But yeah, these are things that people don't think about. If you order out or even eat in a Asian restaurant and they put those disposable chopsticks on the table, those are coated with toxins. I
Yeah.
mean, yeah. So your choice is to ask for a fork or bring your own chopsticks with you. Um, some other things, low quality synthetic supplements. There's a lot of ingredients that are actually full of chemicals. And any products that you take over the counter or even pharmaceuticals that contain dyes and fillers. So many over the counter medications have artificial sweetener in it. Cough syrups, baby aspirin, they're all full of dye. You can't really get any kind of pharmaceuticals that don't have dye and or artificial sweetener. Artificial sweetener, by the way, and we're talking about aspartame, also known as equal, sucralose, also known as Splenda, and they have other names for them now. I can't keep up with all the names. They are neurotoxins, so they actually cause neural inflammation. It's very important to read labels. And if you're ever buying a food that says sugar-free, most likely it contains an artificial sweetener. So they trick you, right? You think, oh, great, this has no sugar in it, so I'm not doing any harm to my body. But then they're putting an artificial sweetener in. Of course, heavy metals are toxic. Most of us have some exposure to mercury, lead, cadmium. Cadmium is in secondhand smoke, by the way. So you just walk through somebody else's smoke cloud. I try to hold my breath, but it's not always possible. And of course, aluminum, we get exposed to aluminum through vaccines. If you've ever had any, aluminum cookware, which a lot of restaurants use, cooking with aluminum foil, and then the antiperspirants that we talked about, technology related exposures, so excessive blue light. You should wear blue light blocking glasses if you're on your devices a lot. Sleep disruption from screens, electromagnetic fields that are extremely high frequency. So I have protection on my phone. See if you can see it. It's right here. This is an EMF blocker.
Oh,
Yeah. So if anybody is interested, you can email Colleen. She's an expert on this, though any minute now she may not be able to answer emails because she's due on Monday, so we don't know exactly when that baby's going to stop cooking and finally be ready to pop out. Um,
Mhm.
some additional hidden sources of toxins, mold exposure. Do you know how many people have mold and they don't know it? Because it's very often hidden. And chronic mold exposure, I mean, mold actually secretes toxins, mycotoxins, and can cause all kinds of health issues. Poor indoor air quality, I do recommend that you have an air purifier. I have one on my website that I love. It's very small, lightweight, and handles a large space. Um, dental teeth. Teeth are a hidden source of inflammation. I can't tell you how many times I've dealt with a tough case that wouldn't resolve, with all these health issues, and we finally figured out it was either an infected tooth or um, an old root canal causing all kinds of havoc. Crowns. Crowns are hidden sources of bacteria which cause inflammation. And of course, metal dental amalgams. Scar interference, we talked about that on our last talk. Scars on the surface of the skin can cause an inflammatory response in your body. And then silly things like not getting enough sleep, not moving enough. Those things can increase your inflammation level. So some of the symptoms you may experience if you do have excess or chronic inflammation, fatigue, brain fog, digestive issues, joint pain, muscle aches, headaches, skin problems, weight loss resistance, in other words, difficulty losing weight, insomnia, or just interrupted sleep and slow recovery. So what you can do to protect yourself, the goal is not perfection. The goal is to reduce your in total inflammatory burden, cleaner food, cleaner water, better sleep, stress management, regular movement, reducing whatever chemical exposures you have control over because you can't avoid it completely, and supporting your detoxification pathways. So I'm just going to do a quick screen share and show you a couple of my favorite things to use for both for detox as well as inflammation. So this is called HMET binder, and that stands for heavy metal and environmental toxin binders. So this is an excellent detox. It's of course completely natural. It has broccoli sprout extract and zeolite, which is something derived from, it's an ancient thing derived from volcanoes that has great binding properties. This is another one I love called Metal Free and Chemical Cleanse. So it's just a great detox for everything. And it has so many therapeutic ingredients. It has cilantro and parsley and stinging nettle and a bunch of different mushrooms and something else that's called C60. And C60 is also, it's anti-carcinogenic. It's just good for overall health. But I just take the C6, C stands for carbon. Oh, and there's also amino acids in here. I just think this is something that everyone would benefit from. I just take it every day. I like the way it tastes. I have some children on it that do not like the way it tastes. Nina, I think your kids, right? Your kids don't like this. Um,
No.
but most people like it. Kind of tastes like, I don't know, to me it tastes like figs or something. The next one is Boswellia complex, and Boswellia is a powerful natural anti-inflammatory. It is made from the frankincense plant. It's also anti-carcinogenic. This Boswellia, in addition to Boswellia, has turmeric in it, and celery seed extract and ginger. So all of those things combined are powerful natural anti-inflammatories. Again, this is something I just take daily to reduce my inflammation and as you know, cancer prevention. And last, another powerful anti-inflammatory and immune support, IFC, which stands for um, inflammation control. It has pomegranate seed extract, olive leaf, artichoke, acai fruit, bromelain, L-citrulline, white mulberry fruit, broccoli sprouts, wheatgrass, blueberry, astaxanthin. Those are all anti-inflammatory, antioxidant, and it is very effective. And you don't need very much of it. That's another thing I like about it. All right, that is the end of my presentation. We are open for questions. If you are going to ask a question, don't forget to unmute yourself. And or it doesn't have to be a question. It could be anything that you want to share about your own health, your own experience, your own health journey.
I have a question.
Sure.
When and if the kids get vaccinated, how soon should they be detoxed, if at all?
Immediately. So I instruct everyone to bring their children in the same day, and we'll start that process. So the sooner we start detoxing, the less the risk of the aluminum doing any damage.
How long does the detox process usually last?
It's different for different bodies. It depends on the body's ability to adequately drain and whether or not the liver detox pathways are working properly. What I want to say is also, somebody else came in. What I want to say is also about that, Nina. Hi, Antoinette. Thanks for coming. Is that it's one of the most important, this is something that's not often talked about. One of the most important things to do if you have to vaccinate, you have no option, is to make sure that the child stays very calm during the process because the stress actually increases the risk that the aluminum will do damage. The stress response will cause an inflammatory response. So the way it works, this is pretty interesting, is that when the child is very stressed and the brain is already sending out inflammatory signals. And then, because by the way, stress is also a hidden source of inflammation. And then the immune system is activated because there's heavy metals entering the body, and the immune system is trying to deal with it and trying to attack the heavy metals. So white blood cells start engulfing the aluminum. These white blood cells called macrophages, their job is to eat up and dissolve the bad stuff, right? So they can do that adequately with things like bacteria, viruses, parasites, fungus, yeast, but they cannot break down the aluminum. And the more stressed the body is while this process is going on, the more likely that those white blood cells will end up traveling to the brain. And we believe that this is the cause of autism in children that are vaccine injured. So what the white blood cells are traveling around the body for a while. It's not an instantaneous process. So the detox, should probably take a minimum of 90 days because that's how long it takes for your blood cells to turn over, your red blood cells. But sometimes it's longer. But what I'm saying is, as a parent, you need to really stay calm. You can't be upset about it. And then you have to help your children to look at it as just a minor event. Like, it's not a big deal.
Okay. But aside from that, nothing else should be done to prepare for the vaccines and then subsequently the detox process, right?
Well, we can make sure that their drainage pathways are open. But I think if I recall correctly, your children are already on a lot of drainage.
Yeah.
So they're probably somewhat prepared already.
Hmm.
Who else wants to say or
I have
something?
a
Share?
quick question.
Sure.
I was listening about detoxing from vaccines. Now, as a child, I had so many vaccines I can't even remember. And I do remember being quite stressed about it, actually. And I have a vivid memory of saying, Mum, I don't like these. Please, no. I was very adamant, but she still insisted on following the alleged good protocol that it would be protective. So I have no idea what my body is like with all of that. And I have not, my one of my sons has not had, say, the COVID vax, the vax, that one, but my youngest son who's in a hospital ward was forced to have it. And I can't actually administer to him the remedies, if that makes sense.
Yeah. Yeah. No, I know.
Yeah.
You've emailed me about it. Somebody who's not muted has some noise going on in the background.
Yeah.
It sounds like a TV
It's,
or something.
I think it's me. I'm gonna unmute me.
Is that your hubby,
It's my
Rosetta?
husband, I think. Hold on.
Tell him I said hi.
Yeah, thank you. Uh,
So Sarah,
Yeah.
first of all, just for you,
Yeah.
um, it is a good idea for you to do a detox. I mean, I was vaccinated as a child as well. Back when I was a kid, there was less vaccines than there are now. So at least, we're blessed with that. Um, but that's one of the reasons why the rate of autism is going up exponentially because there's so much aluminum being injected into children now. But
Yeah.
step one for you, Sarah, would just be to do a heavy metal detox. With heavy metal detoxes, I like to do it very gently. Okay, so I don't like to go in there gangbusters. There's different ways of detoxing. I'm not a big fan of IV chelation, pulling it out of the blood because that's just pulling it out of the blood. We want to pull it out from deep inside the tissue, from the cells, from the organs. And we want to do it gently so you don't end up with what's called a detox reaction. A detox reaction, you can literally feel like a truck running you over. And that did happen to me the first time I ever did a detox before I knew what I now know. I did this major detox. I ended up literally in bed. I couldn't move. I was a runner back then, and I would not miss going out for a run no matter what. And for 3 days, I could not run. So we don't want that to happen. We like to start them very gently. So some of the heavy metal detoxes that I showed you before are gentle. And you start with a low dose. You don't try to do everything all at once. But also when it comes to heavy metals, you have to make sure, as I was saying to Nina earlier, that your drainage pathways are open because the metals need to be able to exit your body. They need to be able to exit through the liver, through the kidneys, through the bowels. So I have a video called How to Prepare Your Body for a Detox. And
Okay.
that's all about opening up your drainage pathways first before you start a detox.
Okay.
And that's the thing that a lot of alternative doctors miss. They go straight into the detox. They go straight into you're toxic. We got to do a detox. Well, yeah, you're toxic. Everybody is. So what else is new? That's not the starting point.
I've experienced an accidental heavy detox and I had to come right off it. It was, no, I can't do this.
Yeah,
It was pointless. I couldn't function and that was no good at all.
exactly. And I feel
Yeah.
like you are a sensitive body. That's the impression I've gotten from the communication that we've had. So sensitive people need to start even more slowly, right? This is not a race. It's a marathon. Achieving optimal health is one step at a time, layer by layer.
Thank you. Thank you.
Sure.
Can I share about my detox?
Absolutely.
Hi, everyone. Quick, Deb, did you share in the last meeting about scars? Was it you, or am I mixing you up with someone else about laser therapy
I
and
think it
scars?
was I think it was Linda.
Oh, sorry, Deb. I mixed up
That's okay.
the ladies. I wanted to thank her because I had gone back to see Dr. Cori because I recently had a series of surgeries and I've been doing some scar red laser therapy, which is helping break up the scar and helping other issues. But for everyone here, I have several serious health issues. One that many know, Lyme disease, and some that many don't know that are toxic exposure from working as a first responder at Ground Zero. That's where I was today. I was at an appointment and I thought this meeting was later today, so I apologize for being late. But I was working with my World Trade Center group of people, and I actually did a protocol in Connecticut, Dr. Garcia's chelation metal detox. Not evil, not bad. However, I'm in that group that Dr. Corey is now working with more one-on-one that's sensitive. I'm sensitive to my own sweat. The proteins from my sweat make me break out. So even my own chemical makeup, I'm allergic to on some levels. So we've been working on some detox. I don't like running. I like playing sports, basketball. I like contact sports. I think that's why I'm a first responder. I like immediate results, very fast, very driven. Nothing goes slow. I don't like running. I don't like marathons, but I like sprinting. So whenever I see Dr. Curry, I put pressure on her. When is this going to get better? How many capfuls? If she tells me 2 for the detox, I do 4. I'd make a great addict. I'm addicted to food. So that being said, for anyone here thinking about IV chelation, I'm not against it. Corey has always respected my wishes and my speed. So she didn't per se stop me, but she cautioned me. I went sprinting up to Connecticut. I did 3, I think it was like a month, right, Dr. Corey, a weekly chelation. It was beautiful. It was great. My body smelled. I had dark things coming out of me. World Trade Center. I had skin peeling. My breath smell. I was very toxic. I was detoxing. But it really affected my kidney. I ended up just having kidney surgery a few months ago. And the rate of detox was so high that it stressed out my body and I ended up in the ER. And I was really close to going septic because there was too much toxic overload in my
Wow.
body.
Wow.
And she didn't pay me to say this because I wasn't even going to be here because I was running around. Look how I'm dressed. But I should have listened to Dr. Corey because once we got me stable, she put me back on the 1 to 2 capsules, the lymphatic drainage. I get impatient, but I do see, and she told me I'm intuitive, how my body reacts. And then when it's reacting less and less, then we increase other things, especially in the full moon. So I'm a full moon sensitive body that detoxes even more during the full moon. So I just wanted to tell everyone, if you're going to do these programs, I do IV vitamins. She knows sometimes there's times we disagree, but her plan is steady and stable. And I think that's what's crucial in the environment we're living in medicine. When we get sick, we want a quick inhaler, a quick pill. I just had pneumonia, the flu from these surgeries, and Dr. Corey helped me get through flu B. I never had flu B. I was vaccinated for flu years ago, nearly died. Now I know I'm allergic to the ingredients in vaccines. How did I know that? Dr. Corey tested me. So I really wanted to hop on today to say, I'm a living testimony of near death, inflammatory issues, toxic exposure from world trade, but also some of these remedies that are good, some of them are too much of a good thing isn't good, and they're toxic in itself. So that's my contribution. Thank you for listening.
That was great.
Thank you.
Excellent.
Yeah. By the way, your teeth look great.
Tomorrow I get the front tooth. Who said that? Because someone saw me.
I did.
Deb.
It looks great.
But thanks
Oh,
to
yeah.
Cori, she's the one that had me take out the root canal teeth that
Right.
started the detox process.
Yeah.
Not
I
cheap.
remember.
Yeah. That's what it was, Deb. We talked about that. Thanks for returning, Deb. I didn't scare you.
Actually, you're talking about root canals. I have 6 root canals. 6. Yeah. And yeah. And actually
So
one
we
crumbled
do
the other day.
we do recommend that you get them removed. I know it's a lot of work, but they
Yeah.
inevitably cause some serious health issues. I'm not trying to scare you, but I just want to give you an example. A patient in her 80s that had a root canal here, and she ended up with tonsil cancer right here.
Oh gosh.
Yeah. And when you get, does everybody know what thermography is? Thermography is
Oh, yeah.
infrared imaging that it's instead of a mammogram, we recommend that you do a thermogram, but the infrared camera can show the crap that's draining from the root canals into the lymphatic system. So root canals kill the tooth, and the body does not like to have dead matter in it. So the body will automatically send bacteria to the area to start trying to break down the dead matter, the dead material. And it'll become a chronic low-level infection that creates all kinds of havoc and inflammation. And I find a lot of people can't fully get well with root canals. You have a lot of them. You know, I had a root canal myself, but this is a quick funny story. I had pain in this tooth, and my dentist told me that it was I had a minor fracture in the tooth, and that's what was causing the pain, and that we should just keep a watch on it and see if it, calmed down. But the pain was getting worse. So he said we have to do a root canal. And I didn't know, this is back, I was like late teens, early 20s. I didn't know any better. Did a root canal, still had the pain. So he said the only other thing we could do is extract the tooth, which thank God we extracted it. But guess what? I still had the pain and it wasn't coming from the tooth. So I went through all of that for nothing. When I finally went to chiropractic school, I found out that the pain was coming from me clenching my jaw. My jaw muscles were referring pain to that spot. And so this is years later, I went back to that dentist, super nice guy. And I told him, I said, do you know, that tooth that you pulled out? That was a trigger point in my jaw muscle. I said, don't you learn about that in dental school? He said, oh, yeah, we do, but I'm going to be honest with you. I never ever considered that as a possibility, as a possible source of pain. And I said, okay, well, thanks for being honest, but maybe, you might want to start thinking about it so you don't pull anyone else's teeth out unnecessarily. I wasn't mean to him, but, like I said, at least he was honest.
Sarah, I had
what-
7 teeth pulled out.
7.
Yes, I had a traumatic injury at work, but when I met Dr. Cori, I had just had a root canal, my 3rd one, and I couldn't walk. I was crippled, and I thought it was Lyme disease. And the ingredients they put in the root canal, she tested me, were toxic. It was infectious. So a month later, I started the process of having these teeth removed, and it started March 2023. And then end of this year, I will be finished with implants, but it did take 3 years, also finances, of taking them out. And then as they took them out, I don't know where you're at, Dr. Cori can guide you. She helped me with dental support and drainage. But I'll be honest, Sarah, it all sounds nice. Take out the teeth, do this, do that. It was very difficult to have 7 teeth removed. It altered my whole life, but I saw health improvements. So I don't know your situation. I'm
Especially
related.
when they're in the front, and
Yeah,
then
mine
there's
were the
the
front.
cosmetic. Yeah,
Yeah, I walk around like
that's
Halloween every day. So, but each tooth that came out, I didn't know I had certain conditions. And when Cori looks at my blood work, things are getting better. And we think it's from the tooth. I got off of heart medicine when they took out the root canal teeth.
Wow. Wow.
Well, I would have to change dentists because I know my dentist wouldn't
Yeah.
touch them. I mean, my nearest dentist in the United Kingdom is probably 3.5 hours away. I'd have to go nearer to London, where you get like holistic dental people.
there's a website, an international website, and I can put it in the chat.
Of the biological dentist, right? Because I think you gave it to me. I found someone in Switzerland, Sarah, and I was going to go there, but because of my medical stuff, they actually wouldn't take me because I needed like one-on-one treatment in the States. But she gave me that website, and I went through 3 different biological dentists because of money, because of what they did. All of a sudden, they want to do everything. So it might take you a few consults.
Yeah, something to save up for and definitely go for. Yes.
It's a lot.
But yeah, I can actually feel sometimes they feel warm. It's like there's a warmness around the,
That's inflammation.
and I think, well, and one of them crumbled, and the dentist says, "Oh no, it'll be fine, it'll be fine." I'm saying, "Well, actually, no, it feels warm. Can't you just pull it out? Now it's crumbled." He wouldn't. He covered it.
We should probably consider putting you on some tooth support in the meantime until you can take further action. At least that will strengthen your teeth.
Yeah, that would be a good idea. Because the
Yeah.
cost of it in the UK is probably thousands of pounds. I mean, I would imagine.
Well,
It's
it's thousands here as well. Yeah.
it'd be private and you know. Yeah, but that thank you. Could you let me know the tooth support?
Yeah, it's called Biodent, but just email us for
Biodent.
tooth support and I'll
I
send you the
will do.
information.
And
I
now
have
listen to that one. Yeah.
I have an interview, a wonderful video and interview with a holistic dentist that I love that video.
Yeah.
Um,
I'm
it's
on that.
coming toward the end of the hour. Did anybody have anything else that they wanted to ask or share? Linda, you were very quiet today. Rosetta, you didn't say anything except that your husband was making noise in the background. Joe, you
No,
didn't speak. Yasmin, you didn't say anything. Deb, you were unusually quiet for Deb.
Well, I was listening to Antoinette and to, but I did want to say, I forget the name. You know, when we all got that shot when we were kids, that prong?
Polio?
Yeah. And what's that disease that goes in your spine that always stays there forever?
Well, I mean, I think,
Not
are you thinking of chickenpox?
not chickenpox, but you have a protocol for it.
Shingles or meningitis?
Shingles.
Yeah,
Shingles.
so shingles comes from the herpes zoster virus, which is
Well,
what caused
I want to
chickenpox.
thank you because I 2 years ago I was cleaning and all of a sudden my leg was in terrible pain, and then I had all this back stuff happen. And I went to your videos and I said, I think this is shingles. And I went to your videos and I got the protocol. I watched a whole bunch of different videos that you had, and I wrote down everything that you said to do in each video. And I bought it on your website and I took it and I was healed in like 3 days.
Wow. And it would have probably been easier for you to just email me. I would have sent you the protocol. But anyway, thank you for you have more reviews on my website than anyone else in the world. So thank you for that.
I go for walks every day with my dog, and I wear my little pod things, and I listen to you, and Mahoney, and I listen, and I learn and I learn. And I, so if I know there's something wrong, I go, what was that video? And I'll go back to all your videos and see your titles. And
If
I,
you
I,
lived closer, I would hire you to come work for me.
I would love that. I would love it. Yeah, I know. It's my passion. That's why I'm here.
I see. Well, thank you for being here.
You're such a good teacher. And you know what's good about you is it's a life lived. You went through it and you figured it out, and then you went to school, and a lot has happened to your physical humanity, and you figured it out, and now you do that with people, and that's amazing. What a gift.
Thank you. And yeah, and it's still happening to me. Like it's still unfolding day by day. Yeah. It's called life.
Yeah.
Anyway, ladies, I did have one man subscribe, and he's not here. So we're still keeping it all girl power, which is nice. So I could talk about my vagina soap without embarrassment. Um, but I appreciate all of you very much. I really do. I think this is just such a blessing that we can get together like this. We'll be taking requests for the next topic, so don't hesitate to email me for any. There's no health topic that's off the table, and the more unusual, the better, right? Because I like to talk about weird stuff. And I'll be sending out it. They're always going to be on Thursdays at 12. I'll be sending out the next date as soon as I am kind of stalling till Colleen gets back, since she's been in charge of communicating with everyone. I mean, Yasmin, by the way, is filling in for Colleen if anybody needs anything. And you'll get the recording of this as soon as I transcribe it, and we'll get it out to you if you want to replay. All right, ladies, have a wonderful rest of
great
your
day.
day.
Thank you.
Thank
See you all
you.
soon.
Thank
Thank
you. God
you.
bless. Bye.
See you
Bye-bye.
soon.
Yes.